Notice, the people appearing in the video are for illustrative purposes only. They may not be real doctors or patients. Thank you. Hello and welcome back to our channel. In this video, we're exploring a critically important topic: alcoholic hallucinosis. Alcoholic hallucinosis is a complex and often misunderstood condition that occurs in individuals with a history of heavy alcohol use. This neuropsychiatric disorder is characterized by auditory hallucinations, which can be distressing and challenging for both the affected individual and their caregivers. Nature of alcoholic hallucinosis. Alcoholic hallucinosis typically develops after a prolonged period of heavy drinking. Unlike delirium tremens, a severe form of alcohol withdrawal known for its visual hallucinations, tremors, and confusion, alcoholic hallucinosis is characterized primarily by auditory hallucinations. These hallucinations can range from simple sounds like ringing or buzzing to complex and often disturbing voices or noises. The affected individuals might hear voices speaking to them or about them, which can lead to significant distress. Epidemiology and risk factors. The exact prevalence of alcoholic hallucinosis is challenging to determine due to underreporting and misdiagnosis. It tends to occur in individuals with a long history of alcohol abuse, typically after a decade or more of heavy drinking. Risk factors for developing alcoholic hallucinosis include a family history of alcoholism, a personal history of psychiatric disorders, and the presence of liver disease or other health complications related to alcohol abuse. Pathophysiology. The pathophysiology of alcoholic hallucinosis is not entirely understood, but several theories exist. Chronic alcohol use can lead to structural and functional changes in the brain, particularly in areas involved in processing and interpreting auditory information. Neurotransmitter imbalances, especially involving dopamine, GABA, and glutamate, are also thought to play a role. These imbalances can disrupt the normal processing of auditory stimuli, leading to the perception of sounds or voices that are not present. Clinical presentation. Individuals with alcoholic hallucinosis often experience auditory hallucinations without a significant disturbance in consciousness or cognition. This differentiates the condition from delirium tremens and other forms of psychosis. The hallucinations can be extremely distressing, leading to anxiety, paranoia, and impaired social functioning. In some cases, the individual may have insight into the hallucinatory nature of their experiences, but in other cases, they may be fully convinced of their reality. Diagnosis. Diagnosing alcoholic hallucinosis requires a careful medical and psychiatric evaluation. It's important to differentiate it from other conditions, such as schizophrenia or bipolar disorder, which can also present with hallucinations. A detailed history of alcohol use is crucial, as well as an assessment of the individual's mental status. Imaging studies and laboratory tests may be conducted to rule out other causes of hallucinations, such as brain lesions or metabolic disturbances. Treatment and management. The treatment of alcoholic hallucinosis involves a multifaceted approach. The primary goal is to safely manage the withdrawal from alcohol and to treat the hallucinations. Long-term treatment includes counseling, support groups, and rehabilitation programs to address the underlying alcohol dependence. Psychosocial interventions are also critical. These can include cognitive behavioral therapy to help the individual understand and cope with their hallucinations, family therapy, and community support programs. Relapse prevention strategies are an essential component of treatment, as ongoing alcohol abuse can exacerbate symptoms and lead to further deterioration of mental and physical health. Prognosis. The prognosis for alcoholic hallucinosis varies. Some individuals may experience a complete resolution of symptoms after abstaining from alcohol and receiving appropriate treatment. However, others may have persistent or recurrent hallucinations, especially if they continue to abuse alcohol or have co-occurring psychiatric disorders. The presence of insight into the hallucinatory nature of the symptoms is generally associated with a better prognosis. Conclusion. Alcoholic hallucinosis is a serious condition that underscores the profound effects of chronic alcohol abuse on mental health. Understanding this disorder, its causes, and treatment options is crucial for providing effective care to those affected. With proper treatment and support, many individuals can achieve recovery and improve their quality of life, highlighting the importance of early intervention and comprehensive care for individuals with alcohol use disorders. And that's a wrap for today's video. Thank you so much for watching. If you found it helpful, please give it a thumbs up. Don't forget to subscribe and hit that bell icon so you won't miss any of our upcoming content.